said, "What's Killing Black Men?" "What's Killing Black Men" was the title of the event that I attended, and I didn't know what it was about. I went. It was a group of. It was a church full of black men, and I was thinking at the beginning of the meeting, man, what if I was thinking about in South Carolina or North Carolina where the white guy went into the church and he shot up the church and killed some black people in Bible study. And I was thinking that I was kind of nervous that I was in that environment with all black people. I was like, man, if somebody wants to just commit a hate crime and kill some black people, this is the perfect event for them to do that. And it was just something I thought about. And I know sometimes we're in public, we're in the movie theater, sometimes we think about things that have happened to other people. And I didn't realize that that was an example of racial trauma because I had never heard the term racial trauma. So he unpacked what racial trauma was for us, gave us examples of what it was, and taught us how to cope with it. And it was really life-changing for me because I realized that a lot of things that I thought was normal, a lot of things that I had internalized, it wasn't normal and it shouldn't be normal, and that we really should be able to do something about the trauma that we experience. So I'm going to give him the floor to let him take it in the direction that he wants to go in. We're going to leave the last 10 to 15 minutes, depending on how long he goes, for Q&A to give everybody a chance to ask questions. If you want to speak, please use the raise hand feature. And if you would like to just put a question in the chat, you can do that as well, and I'll read those off. I'm turning it over to Dr. Kniffley, but right before we get started, I know that some other people from DEP may put some stuff in the chat for some upcoming PDs. So if you want to participate in those, you'll be able to see flyers for those. So without further ado, I'll turn it over to Dr. Stephen Kniffley.
All right, good afternoon, everybody. I just saw a question. It does look like the presentation is being recorded. If you have any difficulty accessing our dialogue at a later time, feel free to let me know. I'll be happy to support you in a way that I can. So I'm going to share my screen here, and we'll get started. All right. So my name is Dr. Stephen Kniffley. I am so honored and happy to be here in this space with you as we talk a little bit about race-based stress and trauma. And I have put this presentation in a way to hopefully be able to answer questions both from an adult perspective, but then also I'm hoping that there are some youth on our presentation as well, and we'd like to offer this information to them in an understandable format. So just a little bit about myself and who I am and why I'm in this space with you today. So as I mentioned before, my name is Stephen. Please just call me Stephen in this space. I am currently the Chief Diversity Officer for Spalding University, where I also serve as an assistant professor in their School of Professional Psychology. I'm the coordinator for what is known as the Collective Care Center, which is our only or one of very few racial trauma clinics, both here in the state of Kentucky and then throughout the U.S. I've been fortunate to have a lot of education. So I have a doctorate and a master's degree in clinical psychology, as well as a master's in public administration. And I'm also a prior graduate from the University of Louisville. I'm a board certified licensed psychologist, both here in the state of Kentucky and also in Ohio. I primarily work with what are known as angry Black boys. I only see Black males in my practice, and specifically focus on working with Black male youth. My areas of interest are all things Black folks, specifically Black male related, multicultural psychology, and also racial trauma therapy, which is why I'm here speaking to you today. I never start any presentation without first paying honor and homage to my ancestors and those folks that have paved the way for me to be here. So if you look at the screen to your right there, that's a picture of myself with my papa, who, along with my grandma, meant and mean the world to me, and I would not be who I am and where I am without their support and their love. I also just like showing this photo now because I have a son who is now around the same age as I was in this picture, and it's just so nice to see that I'm hopefully passing on that same legacy of love and support to him as well. So I've been able to do a lot of different things with the time and resources that I've been given. So I've conducted a TED Talk on how do we have conversations with folks that are different from ourselves. I've written a couple of books, 4 books at this point. 2 that might be of use to you. One is on Black males and mental health treatment, and the other one is on understanding the intersection between Black males and the criminal justice system. I was very fortunate last year to be selected as one of our top 40 under 40 for the city of Louisville. I also run a blog called The Afrocentric Psychologist, where we talk about all things Black folks related when it comes to social justice issues, education, healthcare, criminal justice system, etc. And I was recently selected based on the work that I do around racial trauma and supporting Black and Brown folks around issues of mental health as the recipient of the Healthcare Advocacy Award from Medical News. So as you think about either yourself identifying as a person of color or working with youth of color or having colleagues of color, I just want to offer up these affirmations for us to center our conversation as we have the hard and difficult dialogues around racial trauma, race-led distress, and either the ways that we've been impacted by it or the ways that we've perhaps perpetuated that particular system of racism. So I always want to let my Black and Brown folks know that they matter, that if we're able to know ourselves and conquer the enemy within, no enemy without can do us any harm. Continuing to remind our Black and Brown brothers and sisters that we are enough, that you are enough. From our collectivist standpoint, our purpose is for our people. Society doesn't define who we are as Black and Brown individuals. Instead, we have the ability and have always had the ability to define our racial and ethnic identity however we so choose to do it. Reminding ourselves that our history started way before our encounters with oppression in the form of slavery and second-class citizenship and discrimination, racism, etc. And that even though oftentimes the history books don't acknowledge that history, that we have been around for a very long time and will continue to be around for a very long time, and that our history isn't just rooted in one particular awful encounter. Remind ourselves that it's okay to not be okay, that either the strong Black woman stereotype or the strong Black man or John Henryism stereotype, this expectation that we should just keep our heads down and just keep on pushing. It's really leaning into that survive, not thrive perspective, that is actually part of the reason why we're having the difficulties that we are in. So although that served as a point, served as a resource and a helpful way to think about things early on, it's actually caused us more difficulty now. And so remind ourselves that it's okay to not be okay, and that if we're not okay, it is certainly more than welcome to get the help that you need. Remind ourselves that no one can make us feel inferior without our consent. People can call you names, people can try to bodily harm you and do all those type of things. But at the end of the day, it's ultimately up to you to decide how much you will internalize when it comes to the negative messages that people want to say about you and about people that look like you. And the last piece here is that you've been given the resiliency of your ancestors in your DNA. So if we think about all the difficulties just here in the US that Black and Brown folks have experienced when it comes to slavery and genocide and, you know, all concentration camps and all those things that they put various Black and Brown folks in, somehow we've still survived and somehow we've still thrived in the midst of all of that. And that resiliency is coursing through your veins, is encoded in your DNA the same way it was in your ancestors as well. So a little bit about why I was inspired to do this type of work when it comes to understanding and supporting folks that have experienced racial trauma. I'm using this as an opportunity for us to think about how we can also then be equally inspired to support Black and brown folks as well. So I've had the opportunity to travel all over the world at this point, and two places that have always been near and dear to my heart are South Africa and Senegal. And Senegal is located on the western coast of Africa, and South Africa is located at the bottom of the continent. And so there were two kind of concepts and ways of talking to one another that I gathered during my time in South Africa. The first one is this idea of Ubuntu. Black and brown folks might have heard this quantified in the proverb, I am because we are, and we are because I am. And that essentially is what Ubuntu is all about, this idea that we are all relationally connected to one another. So if I heard, you heard, if you heard, I heard. And if we think about many individuals that have experienced racial trauma, they oftentimes feel alone and isolated, like no one really understands the experience that they're going through. And so what we can do as folks that are supporting our youth that have experienced racial trauma is by reminding them that they are not alone, that there is a community behind them, in front of them, and beside them to give them the help and support that they need. While I also was in Senegal, I happened to have the opportunity to interact with and connect with folks from the Zulu ethnic group. And they have a greeting over there, which is called Sawubona. Sawubona. And essentially what Sawubona means is I see you. And I always just thought that was such a cool way for one another to greet each other, is by letting them know that I see you, not just for how society sees you, not just for how perhaps the history books talk about you or how the media talks about you, but I see you how you wish to be seen. And I think that's something that we have to remind our Black and brown youth as well, is that I see you for how you wish to be seen. I don't see you just for how the media tries to portray you as a dumb, deviant, or dangerous individual. Another concept here is this idea of Sankofa, which is all about looking back, a kind of reconnection to our past and current history. And as you look to the center of your screen there, you notice that I'm standing at this door. This door is called the Door of No Return. An opportunity to tour a slave fort off the coast of Western Africa and Senegal. And the reason why this door is called the Door of No Return is because as the slaves, enslaved folks were marched through that door onto the boats that were taken to the Americas, they knew that they would never really see their homelands ever again. And so they would never return. But I always found it powerful that I was able to stand in that door, because most likely one of my ancestors either walked through this very door or a door that was very similar to it. But I believe that one of the reasons why they were able to survive and to make it through all the difficulties that they endured is because they knew one day the first doctor in our family would be standing at that door, having returned to our ancestral homelands. And so that's one of the things that we have to remind our youth as well, is to really explore and navigate what their history is outside of the slave narrative that's oftentimes portrayed. Like if you look at many of our streaming services right now that are showing, in quote, Black voices movies, many of those are just a caricature of different slave periods for folks. And although that is really helpful information for those folks that haven't been exposed to it before, our history exists well outside of just the slave narrative. So reminding folks that we can't just lean into just that limited piece of our history. There are other things that Black and brown folks have contributed to outside of that particular narrative. The last piece here is, if you can conquer the enemy within, the enemy without can do you no harm. And this is a African proverb, and I've translated this as to think about how we can conquer that enemy within in the form of internalized racism. So many of our youth, based on exposure to media, based on the history that is taught to them, based on their connection to folks around them, have really internalized this very negative way of thinking about themselves, where they feel like they are those dumb, deviant, and dangerous individuals that society oftentimes tries to portray them as. And so part of our role when it comes to supporting our Black and Brown youth that have experienced racial trauma is by encouraging them and supporting them as they wrestle with conquering that internalized racism that is from within. So if we want to be helpful to our Black and Brown youth and students, we have to remind them that they are not alone, that we see them for how they wish to be seen, continue to encourage them to connect to their history, and also support them as they try to conquer that enemy within in the form of internalized racism. So you might wonder, well, why even talk about racial trauma? There are other forms of trauma out there. There's emotional trauma and physical trauma and all those types of trauma. Why specifically talk about identity-related trauma? And so there are a couple of things to note here. Black people here experience racism on a daily basis. Right now, the current stat is about 96% of Black Americans report a daily experience of racism and discrimination. Black people can have poor mental health because of racism. So suicide and depression is on the rise, especially for our Black male youth, with depression having quadrupled in the last 20 years, and suicide now being the third leading cause of death for Black males across the lifespan. Additionally, having access to money and education doesn't protect Black people from the impact of racism and discrimination. And so here in the city of Louisville, the average life expectancy for a West Louisvillian is about 12 years less compared to white individuals that live on the east side of town. However, if a Black individual was to move from West Louisville to East Louisville, that same life expectancy still follows them, where they will still live about 10 to 12 years less than their white neighbors in those East Louisville neighborhoods. And so this idea of money and education really doesn't provide the same type of buffer or protect Black folks in the way that we would expect it to. And the last piece here is that for Black folks, they experience more hate crimes than any other racial group in the entire US, which is suggests that Black individuals are perhaps the most hated racial group here in America. And so the reason why it's so helpful for us to have these conversations is because of the daily experience of racism that Black folks are experiencing, about how this is impacting their mental health, about how we would assume that certain access to money and education would offer protection that doesn't exist. And then also just this general understanding that Black folks experience hate crimes at a higher rate than any other racial group, which will contribute to that race-related stress and trauma that are a part of our conversation today. So the science has suggested that what contributes to race-related stress and trauma for Black and Brown folks is this idea of microaggressions. And so microaggressions are those vague and unclear racial insults that happen towards people of color. There are three different types of microaggressions. There are micro insults, which are communications that are rude and insensitive in nature towards a person of color. There are micro assaults, which are the use of verbal or nonverbal racial attacks, such as using the word thug, because we recognize that it is no longer appropriate, at least in most circles, to say the N-word in describing Black folks. But you can use the word thug and essentially say the same thing, but that is a socially acceptable term. And so that's in the form of a micro insult. And a micro invalidation is when you do or communicate things that exclude or deny the experiences of people of color. So by saying, that I'm colorblind, or saying things like, I don't care if you are black, brown, purple, or green, or yellow, or any of those type of things. It negates the fact that there are very real experiences and consequences to being an actual black and brown person. And so to say that it doesn't matter what color that you are really negates those experiences for those particular people. Some other examples of microaggressions for micro insults are saying things like, "You're a credit to your race." For micro invalidations, is saying things like that colorblind racism, so I don't see color. We're all a melting pot. We're all Americans, and everyone can succeed if they just work hard enough. And the difficulty with that last one particularly is that although it sounds well-meaning and is consistent with what we believe to be the American dream here, what it negates is this idea that there are very real systems in place that intentionally make things harder for Black and brown folks. So if I work hard, yes, I can certainly achieve, but there's an expectation within those particular communities that I perhaps have to work twice as hard or 3 times as hard just to get the same outcome. So I want to see if I can play this video here. I haven't did this yet on Google. We'll see if this works. So are you all able to see it?
No.
No? Okay. Let me stop sharing. Let me try to present. No. Are you able to see it now?
It's loading.
Yes.
Yes.
Okay. I'm gonna play a couple seconds though. I just want to make sure that you can hear it as well.
Good morning. How are you? Cool. So, can we talk about how you got here?
You think I gotta tell you what you do?
Yeah, kids, I'm telling you, go right here.
Man, we ain't doing nothing.
Go right here before I'm cookouts.
So, you didn't do anything? Nope. Then what's all this?
Depends on who's reading it, I guess.
Well, looks broken. Skateboarding, huh?
Yes.
Is this the first time you've hurt yourself?
No, I get hurt all the time.
At home?
At home? He hurt himself skateboarding at the park.
Okay, ma'am. I'm going to have a counselor come in and speak with you.
A counselor? For what? He's okay.
Well, I done told you them tricks were gonna put you in the hospital.
I'm sorry.
I'm sorry, too. The nurse will be in a few minutes to help you check out.
What's up?
That doctor thought I did this to him.
How you doing?
Hi.
It ain't fair. Fair has nothing to do with this. This is about you taking responsibility for your actions. Look, I know so many young men just like you that didn't do anything. And yet, most of them are in prison.
You don't know me. I ain't going to no prison.
If you don't want to end up in prison, you're going to have to get some new priorities and probably some new friends too. Look, you're not getting any younger. You need to get an education so you can get a good job.
Like you just like everybody else. You think you see, but you don't see. You see what you want to see.
I see what's in this folder. It shows me what you've been doing.
I ain't doing nothing.
I am not doing anything. Stop!
I ain't doing nothing.
I'm not doing anything. And yes, you were. Get to the timeout chair. Now, please. I'm sorry. I am so sorry.
So think about what microaggressions that you saw in that particular video, and then also think about either as someone that has perpetrated that microaggression or has been the recipient of that particular microaggression. Think about what that has been like for you. So microaggressions that we've talked about thus far are micro assaults, micro insults, and micro invalidations. So, you know, think about the microaggressions that you saw, where they fit into those particular categories. I think if you have either been a recipient or have been a perpetrator of one of those particular microaggressions, think about how did that situation make you feel? And then also think about how did you respond, both either realizing that you committed a microaggression or by being a recipient of the microaggression. So the reason why microaggressions are so helpful or important for us to think about when it comes to the experience of race-related stress and trauma are this idea that microaggressions, when we first experience them, like the young man was experiencing in the video, it's not a big deal, right? So we're able to utilize our coping skills, such as countering the narrative that the person says. So if they ask, you know, do you play basketball? You can say, I'm also a doctor, and all these type of things. You can seek out sources of support that affirm that you are a whole person and not just the stereotype that people will reduce you down to either. But the difficulty with microaggressions is that most of us, in fact, almost all of us, never just encounter one. And as we had talked about before, most Black and Brown folks experience microaggressions on a daily basis, which means our ability to use our good coping skills oftentimes becomes exhausted. It's the same thing as having to use the same muscle all the time on our bodies. If we have to use that muscle all the time, it becomes fatigued and it becomes harder to use it because we never give it time to rest. And so what happens instead is that we start using what are known as bad coping skills to help us to address microaggressions instead. And so that can mean being isolated from others, so always wanting to be by ourselves, being angry with others, and so lashing out and being irritable towards folks around us. It can mean utilizing things that can calm us down, or we perceive to calm us down, such as substances or something along those lines. And all of that can really contribute to this idea of race-related stress, because none of those strategies really works out all of that well. And so we actually end up becoming more stressed out rather than less stressed out because the bad coping skills are working, or we're too tired to use our good coping skills, and instead we're just left with a whole bunch of stress. And so this kind of contributes to a cycle where we experience those microaggressions, those micro insults, those micro assaults, and those micro invalidations. We try to use our good coping skills, but just like using a muscle a whole bunch of times, those skills become tired, which means then that we try to use bad coping skills instead, and we find that those don't work. And so then we're just left feeling stressed out. And that stress is connected to our race, which means then that it's race-related stress, which means that we are more vulnerable, we have a greater likelihood of experiencing what is known as racial trauma. And then that cycle just kind of continues. And so I just want to, have a conversation here around, well, what does racial trauma look like for our youth? And so there are some mental health as well as physical health symptoms for us to think about. So the first couple ones here are around feeling more hyper, having difficulty concentrating in class or at home. There's this term called alexithymia, and it essentially refers to not feeling like we can express our emotions or be able to recognize the emotions in those around us. And one of the reasons why I always like to highlight those two is because as a child psychologist, I'm oftentimes referred folks for ADHD or attention deficit hyperactivity disorder. And the struggle that I always have is, are we doing a good job ruling out trauma, specifically here, racial trauma, because those two might look exactly the same, although what causes them are completely different. Additionally, as someone that works primarily with angry boys, much of the time that these boys are angry, it's also because they are unable to access other emotions. And so the wonder is, are we dealing with a traumatized kid who has lost their ability to communicate their emotional experience to other folks around them? Additional symptoms that a youth might be experiencing is difficulty sleeping, what is known as increased vigilance and suspicion, also just feeling more sensitive to the potential threats around them, feeling like they have nothing really to live for, that things won't really improve for them because they feel hopeless and helpless and powerless in the situations that they're in. And then they also might experience other symptoms such as that difficulty concentrating, such as the difficulty sleeping, and other types of symptoms as well. So those could be more somatic symptoms such as stomach aches or headaches, or just a decreased immune system, so you're not feeling as well more days than not. You might feel like you're having anxiety or panic attacks often. All of those are kind of some of those more physical symptoms that might mean that you are experiencing race-related stress and trauma. So one of the challenges that we face in the education setting is that many of our youth are coming in with what are known as trauma-influenced behaviors and emotions, which are things like hypervigilance, so constantly being on the lookout in your surroundings for danger, aggression, irritability, poor decision-making, and then other mood-related symptoms such as anxiety and sadness. And so there are two different approaches that we can take to interacting with those trauma-influenced behaviors. We can either ask the question, what is wrong with you? Or we can ask the question, what has happened to you? And if we ask the question, what is wrong with you instead, that can lead to what are known as biased informed perceptions, which means that we will have lower expectations for the youth's ability to achieve, to emotionally regulate, to have good social skills, and then to engage in good decision making. But what we'll have higher expectations for is deviant behavior, aggressiveness, and then the perception of learning challenges. And if we continue with the what is wrong with you perspective, then we assume that there is something external to the youth that we can use to, in quotes, fix whatever challenges that they're having, which means that we're more likely to use containment practices for discipline rather than skill building practices. And this can lead to a more disproportionate use of suspensions and detentions, and in a lot of ways, increase the number of race-related stress and symptoms of racial trauma that the youth is experiencing. So we've talked a little bit thus far about what is racial trauma. We've talked about the mechanism that contributes to racial trauma in the form of microaggressions, those micro insults, micro assaults, and micro invalidations. We've talked about some of the physical and mental health challenges that our youth might face in regards to hyperactivity and poor concentration and difficulty communicating their emotional experience, difficulty sleeping, having more sick days than not, just things along those lines. We talked a little bit about how it might impact a youth in the area of education, about the role that many of us can play as helping adults by asking the question, what has happened to you, rather than leaning into the what's wrong with you perspective, because that will allow us to reduce our bias and be able to help them to build skills rather than just contain trauma-related behaviors. So I just want to spend a little time here just talking about how we can help others to get help. These are some things I would recommend. The most, so an important thing to consider here is the importance of being present. Remember in the beginning, we talked about how many of our youth who have experienced racial trauma or race-related stress oftentimes feel alone and like no one understands them and no one is there to validate what it is that they're going through. And so it's really important for us to just let them know that we're here to be a support, and that sometimes that support just requires us to just be present with them, to be able to sit with them as they're going through this difficult time. Reminding them that it's okay to not be okay and that they don't have to put on the strong face, that instead, if they need help, there are places where they can go to get the support that they need. Recognizing how important it is to validate emotional expression. So when we see the anger, encouraging what's underneath that anger, which is typically guilt and shame and fear and anxiety and a whole host of other emotions that the youth does not feel comfortable expressing without some support, which is where that encouraging vulnerability is important. Another thing to do is to help connect our youth to long-term support, such as our center here in Louisville, where we provide free and accessible services in regards to racial trauma for those that need it. Remembering to check in regularly, also being willing to dig deeper past the I'm fine, or I'm okay, or I'm all right, being able to ask additional questions outside of that. Continuing to remind our youth, utilizing those affirmations that we started with in the beginning of their strength and resiliency. Letting our youth know that you care and are here for them. And then also in the midst of all of this, especially if you are an adult that works with our youth, making sure to take care of yourself. That way you are not experiencing caregiver burnout or for compassion fatigue or any of those other challenges that come along with trying to support folks that have been traumatized due to their racial background. So folks might wonder, well, how do I move past the are you all right? Are you okay? I'm fine. I'm okay perspective. And so what you can ask instead of how are you, you can ask, what is giving you a happy thought? What do you need from me today? What are you doing for self-care? How can I connect you to someone? What's a new ideal topic or discussion that's giving you energy today? What's something that has inspired you to be your best self? And then always lean into that posture of gratitude by asking folks, what are you grateful for today? Because that will help us to focus less on the negative and more on the positive things that are around us. And each one of those will elicit a response that's not a I'm fine or I'm okay. So another thing we can do is we can encourage our youth to lean out of what are known as racial legacy approaches to resolving issues related to racism and discrimination, and more into what are known as racial literacy approaches. So for many youth, and in fact, I just did this in the beginning of our presentation, there's these sayings that we get as young folks about how to navigate race relations through just these aspirational or informational sayings, like the one I gave at the beginning about having to work twice as hard to get half as much as a Black and brown person here in the US. And so what these messages are good for is that they emphasize the importance of understanding racial dynamics, but the difficulty is that they really don't tell us, well, what do we do when we actually encounter those situations? And so that's where the racial literacy approach kind of takes things from there. And so what it helps Black and brown youth to be able to do is to accurately assess the situation to determine what racist thing has happened, to be able to gather or determine what their ability to cope with the situation is, and then be able to determine based on the coping strategies that they use, do they feel like they resolved whatever the situation was? And so the racial literacy approach asks us to engage in three questions. What racist thing is happening? Do I have the resources to handle it? And after I have handled it, did I resolve the situation in a way that was meaningful to me, and then also offered a way to address the racist situation in a positive manner? So I just want to offer up that we do have our collective care center here. Once again, we offer free and accessible services to folks that need it. We see folks right now as young as 5, all the way up the lifespan. We do both individual and group therapy. We are working virtually right now, but we are a clinic that is housed and only has Black and brown clinicians that are supervised by Black and brown folks that only see Black and brown individuals. And so it's really a clinic that is there to support folks that have experienced racial trauma based on the use of evidence-based practices. So I just want to leave our last 15 minutes or so to answer any sort of questions that you might have. My contact information is here. Feel free to contact me at my email, which is skniffley01@spalding.edu. You can check out my website, the Afrocentric Psychologist, at drstephenkniffleyjr.com, or you can feel free to follow me on Instagram at Dr. Stephen Kniffley Jr. As well.
All right, thank you. So if anyone has any questions, you can use the raise hand feature or put it in the chat. I already see one, somebody asking, are you accepting new clients?
So we are accepting new clients as a center, yes. We would be more than happy to see anybody that identifies as a Black or brown person that needs support. And right now our services are completely free. So whoever needs it, we're more than happy to see.
Okay, I see a question. I think that's more for JCPS staff, but in your opinion, is there any way for JCPS to provide support for the center?
For the center, so the CCC, specifically myself and JCPS, we already have a partnership where I've provided consultation and support on some racial trauma education initiatives, both district-wide and then also for teachers. I believe those should be rolling out here soon. And so that will equip you with a couple more skills to be able to navigate racism and discrimination within your classroom. But also, I'm more than happy to work with anybody that needs additional support as well in the meantime. Like I said,
so if you don't mind, can you put up your last slide again? I think some people want your contact information.
Sure, absolutely.
And I'm gonna get to that in a second, shot straight. But I think somebody raised their hand. It went away, but I believe it was Faye Munford. I believe. And if it wasn't Faye, if you were, I only saw one hand. Okay, go ahead. Go ahead.
Cool.
Okay. Maybe she didn't have a question. Okay. Question: is there additional training for our white mental health practitioners?
Yes. So if you go to the website, drstephenkniffleyjr.com, there's actually, I just posted a link to a new training kind of module. Let me see if I can find what I titled it. That just says navigating racial trauma therapy as a white clinician. You're more than welcome to check that out. I do offer training in racial trauma therapy if that would also be helpful. But specifically for white clinicians around that particular question, I recommend that you check that out. It's about a 35-minute training just on things to reflect on and consider when you're engaging in racial trauma therapy with Black and brown folks.
All right. Is there any other questions, any other comments? Okay. It's a lot of compliments to you and your presentation.
No problem. If there's any way that I can be supportive to folks, you have my contact information. I'm certainly willing and happy to consult, to have conversation, anything I can do to be helpful to you as we support our students as well.
I want to tell you, thank you so much. I definitely took a lot of notes. And one thing that I believe it was Kumar Rashad put in the chat, we talked about microaggressions, saying that it doesn't feel like it's micro when it's happening to you. I think that was very powerful. And I also like I think it's Sawabona. I see you, and that's for how you wish to be seen. That was very powerful as well. So thank you so much. We will be posting the video on the JCPS DEP1 Twitter. Give us until tomorrow to get that posted, but I'm putting it in the chat. Make sure you follow me on Twitter, and if not, if you want to email me, I think everybody on here has my email address. But if you want to email me, then we can send that out as well. But it'll be on the JCPS DEP1 Twitter account. So if there are no further questions or comments, there's a lot of people commending you in the chat, but I don't think I see any other questions. So check real quick before we log off. Yeah. All right. So thank you everyone who tuned in today. Thank you, Dr. Kniffley, and stay tuned. Continue to follow DP for upcoming events and PD. So thank you so much, everyone.
Thank you.